around the state where members of congregations have been affected, and before they know it, they are spreading that in their local community. I know firsthand what a tough call that is. My church has experienced the same, moving from not electing to do that last Sunday, but moving to completely online this Sunday. I know many people have differing opinions on that. I'm very sympathetic to it, but I will tell you that there are real-world solutions, that are real-world problems that have happened out of infected people going to these services and helping spread and create hot spots around our state. So I would ask those religious leaders to pray deeply and to consider holding services online or delaying those services. The next question is, I'm interested in hearing the latest on the regional test sites that the state is working with FEMA to set up. Are those close to being ready? Yes, they are. Those lists are underway. We'll be announcing that as soon as we can, but I can tell you that those facilities are being stood up right now. There was some soft testing that began yesterday to make sure we have the process and the procedures down, and we'll continue to share that information with the public as soon as it becomes available. The next question is, what is my message to Georgians who are worried about making ends meet because they've been laid off or lost hours at work because of the crisis? I can tell you that here in Georgia, we continue to work with the Labor Commissioner Mark Butler and his department to issue guidance and help people in this difficult time. I know from my call today with the President and the Vice President and the nation's governors that they are continuing to follow this issue very closely, especially industries that have been adversely affected when you think about the state of Georgia. The airline industry, hospitality industry, the convention center businesses, and certainly small businesses that have made the tough choice to shut down or been forced to do so. The next question is, how concerned is the governor about the situation in Albany? I can tell you that I'm very concerned. There were 2 funerals in Albany that have led to multiple cases and possibly 4 deaths in Dougherty County. This situation could not be more serious. I want to urge the community leaders, the business people, the faith leaders to all have a conversation to educate the public of why it's important for people to do the right thing and to do it immediately. Social distancing, stay at home if you potentially could have been attended one of those funeral services, and many, many other things. I will tell you, late last night I was on the phone with the chairman of the commission down there who is doing great work to work with the local community to raise awareness. I asked him specifically if there's anything he needed me to do, action he needed me to take. He mentioned a few things to me which we have already deployed the Department of Public Health resources there. We are working on the additional quarantine site that they feel like they'll need to be made available. GEMA's working on that. So we have the EPI team, I believe as well. Dr. Toomey may want to speak to that, but I believe they're already on the ground there, and we are on top of that situation. But we need the community's help to stop that. The next question is, do you expect the number of cases to go way up over the next couple of weeks? Absolutely, I do. I believe, as we've said early on, when we didn't have many tests back and we didn't have many results in, that the more we test, the more we will find. We certainly saw that today. I think that will continue. And I will tell you that our whole team that is literally working 24/7 on this continues to analyze the data, not only here in our state, but comparing that to other states and cities around the country so that we can gauge how that situation continues to move, and we will continue to do so and continue to base our decisions on that data and the advice of our medical community. The next question is, how close are we to capacity on ICU beds and ventilators statewide? I will tell you that the Coronavirus Task Force has taken an inventory on our resources to see what we have available now, but also to think through what are our needs going to be in a week, the next 2 weeks, and potentially further out than that. We've got a great team, and there's many people working on that issue. We've had great cooperation with the medical community, especially the hospitals around the state, and we have folks looking at procurement and other things to help us solve that problem. For those of you that followed the call with the President and the Vice President today, I've asked them to consider keeping the federal medical facility that was stood up to support the cruise ship passengers that we have been housing at Dobbins. I've asked them to consider leaving that facility stood up after they leave to help us with the surge that we are starting to see and that I believe that we will see in our metro Atlanta hospitals. But Georgians should know that we are going down every nook and cranny to find resources that will make bed space available to the hospital. And I will tell you, our hospitals continue to do some incredibly creative things, and there's a lot of people working on this issue. The last question I got, and then we'll turn over and see if we had anything else come in, is could Governor Kemp talk about the state revenue picture and what he thinks this means for the end of the current year budget and the upcoming budget in 2021. I will tell you that we continue to monitor that. That is something that our state economist, Jeff Dorfman, the OPB, our budget director, Kelly Farr, the two chairmen, Chairman England, Chairman Jack Hill from the House and Senate Appropriations Committee, and many, many other people are continuing to work on. We realize that this is going to be a very tough environment. We don't know exactly what the federal government's going to do from a disaster funding. I threw out an issue today to the President and the Vice President. I know there were other governors on that call that weighed in after I did that supported that idea. I know they have many, many things being thrown at them right now. We have made and are in the process of making our congressional delegation aware of that issue. But I know that is something that the President and the Vice President are taking very seriously. And there's been great conversations. We've had conference calls with them weekly or bi-weekly that are, have lasted, some of them as long as an hour and a half, hour and 45 minutes. Today, I know it was at least an hour and 15 minutes. They answered every single question from whatever governor that wanted to ask it. And they got a lot of ideas on their plate. But the thing is they're considering those. And
This is CBS 46 News at 5. Getting results.
Good afternoon. We were just watching the press conference with Governor Brian Kemp in session speaking about the latest coronavirus issues. We will update you on that. Good afternoon. I'm Sean Yates.
And I'm Brittany Miller. The death toll from the coronavirus is now growing in Georgia.
Health officials say the state's coronavirus death toll has risen from 4 to 10. There are at least 287 cases. Today, President Trump held a conference call with the nation's governors on the coronavirus response. He also announced the FDA would fast-track testing and anti-malaria and arthritis drug to be used as treatment for the virus.
And the administration continues to negotiate with Congress on a $1 trillion coronavirus bill. It includes direct checks to many Americans, and at least 2 House members have announced they have tested positive for the coronavirus.
Let's go back to Brian Kemp, Governor Brian Kemp. He is now speaking from the Gold Dome with the very latest regarding coronavirus. We're going to listen in right now.
Newly purchased 500 test specimen collection kits. So this is to be distinguished from the test that's done in the lab. You need a specimen collection kit in order to secure the specimen to send to the lab. Our public health laboratory, by the end of next week, has over 200, the capacity to test over 200 of these specimens. But you need to have these swab kits to secure the specimen. So we have 200 now. 500 now. We will distribute them across the state. And in addition to these 500, we'll be getting additional large number of test kits, as well as testing to be done by a private laboratory, to be done at the newly stood up kind of, I'd call them SWAT sites across the state. I wanted to talk a little bit about that because there's some confusion about who can be tested and also how that process works. The high capacity sites were actually selected precisely because there are some areas of the state disproportionately affected. Metro area and Bartow and and Rome area have many, many cases. And as the governor noted, some of these cases actually emerged out of church services. So we're particularly sensitive to this issue because of the way we've seen spread in these areas. So we have selected Cherokee County as the site, as a testing site, not because of the actual central location to serve both Rome, Bartow, as well as the greater metro area. And we are hoping we'll be able to do over 100 specimen collections a day, if not more, once these are ramped up. And we're hoping that will be done, will be set up as early as tomorrow, and certainly working in progress by next week. The second site where we have one of these high capacity sites will be Albany. And as the governor noted, Albany is one of our areas, hotspots around the state. We recognize we have to work very diligently with the hospital there, as well as the broader medical community, to ensure we have the capacity to follow up individuals at high risk. We have limited testing statewide, even at these high capacity test sites, to the individuals who are most at risk for infection, that is the elderly, that's over 60 years old, those with chronic health conditions, and those are symptomatic individuals, not just people who have these conditions, but who actually have symptoms already, but also healthcare workers. Healthcare workers are the first responders for us. They are on the front line. We have to ensure that they are healthy and safe and able to provide the care that we need. Also EMS and other first responders, police, fire. These will be our prioritized people to be seen at all of our test sites statewide, not just at these high capacity test sites. We have worked with the private sector, both hospitals as well as private sector physicians, community health centers, others, to get these guidelines out and to arrange a mechanism to actually have referrals into these sites. And so it's a simple process to make this referral. We should be able to have the capacity statewide to take these referrals from providers. And part of this is because we have been asked by providers to do this. Many primary care providers and pediatricians, family practitioners, others across the state don't have the capacity within their offices. They don't have the equipment, don't have these specimen collection kits to do this testing. We want to be able to allow them to do this testing, and we will be working in partnership with them. So this response is literally a public-private partnership, the healthcare system partnership with providers at the local level, hospitals across the state, and public health across the state. So we have all hands on deck, all of us, whether you're in the private sector, a hospital sector, or public health. There's a lot of questions too about why have our numbers gone up so dramatically? Part of that is, as Governor noted, is we're doing more testing, but also it's not unexpected. We are seeing community transmission, particularly in some of these hotspot areas. And so in some ways, the message we're trying to get out to everyone is that testing is important, but the most important thing that Georgia Public can do right now is follow these guidelines to stay home. Don't go out if you're sick. Honor the social distancing requests. Help your elderly, that they don't have to go out and secure groceries or get themselves exposed. Make sure that you protect your neighbors as well as yourself. And as I've said so many times, our response to this epidemic is going to require all of us working together, not just to protect ourselves and our family, but also the whole community. So it's going to take this collective effort of working together to ensure that we can combat this virus. And I believe that's most of the other questions I had. I also received a question about the quarantine in the Georgia House and Senate. And I just wanted to say that decision was made certainly in consultation with me, but also that recommendation was not any different than we would make to a church, to a school, to any other situation where there was the potential for widespread transmission, widespread exposure to this virus. And it's the right thing to do. We're so concerned that we want to stop transmission wherever possible. And so this was not done just because they were legislators. This was done because this is what we need to do in every situation where this kind of exposure may occur. And I think that answers most of the other questions that I had. Thank you very much.
I want to again thank everyone for joining us. I want you to know that we're going to continue to keep fighting every day. We need your help, as Dr. Toomey said. We'll continue to keep you updated as we have new developments. And please just continue to practice the things that we're asking. Have a great evening.